Welcome back. The next feature that I wanted to show was the case evaluation. So I try to think of the case evaluation not so much as did you do everything exactly perfect, but maybe some thoughts on things maybe you should order, things that are indicated, maybe some treatments you should have thought about. We all know that there are guidelines and there are best practices, but big picture, there's a lot of gray area in medicine, and there are different ways to practice. There are good principles that we should all follow, and good guidelines at times, but at times you have to make your best clinical decision, and there are acceptable decisions that are different than what other physicians do. And that's something that I really want to try and help students understand is what are things that you should always do for a clinical scenario? What are some other things that you should think about, or things that you did that weren't indicated, or things that you didn't do that were indicated? So I'm going to demonstrate this with a stroke case. And so let's go ahead and start this case here. The first thing I want to do though is demonstrate how we've been able to use the patient. You can see that there's facial droop there, and you can see she's moving her right leg but not her left leg. And so just the robustness of the stroke case. But let's go to the computer here. Let's see, things that we always do for strokes. I'm just going to use this as an example. We always get therapy for them. It's extremely important. And so we've ordered the therapies. We have our documentation here. But what I want to show you is the evaluation. So let's discharge and go to end of simulation. So acute ischemic stroke. These are kind of categories of thoughts of maybe how you could think about a stroke case. And we know that stroke cases, there's a lot of things that we must do, especially in a certain time frame, and that this is very protocolized. And so students should really know that and have the opportunity to go through a scenario. Did they order the right things? Was the patient a candidate for certain interventions, or were they not? So let's click here, last time known well. So you always want to assess it. So you think about a last time known well. Are they a candidate for intravenous thrombolysis? Are they a candidate for mechanical thrombectomy? Appropriate workup. And so we have our scroll box. So we have an appropriate workup here. And so it said these were indicated, but they were not ordered. Medical optimization, medications, aspirin, clopidogrel, high-intensity statin. And this doesn't cover every case that's going to be presented, but the main goal is foundational concepts for students to understand when they have this case, which is an acute ischemic stroke case, that was not a candidate for thrombolysis, was not a candidate for thrombectomy, that these are the core evaluations that they needed to perform. And this can further provoke more discussion, especially if the student is using this with their school, on even further review of being able to say, every stroke patient needs to have an echocardiogram with a bubble study, and then saying, well, they didn't order that. Perhaps they didn't understand why we do that and why we're looking at that in stroke patients. And then down here, physical evaluation, and it tells us, we ordered it. And so as time goes on, these evaluations, quote unquote, will get more robust. But I think the goal is to follow the user through the simulation and gather data, which this data is all gathered on our back end as well, so we can at some point demonstrate to the user maybe how they've improved over time, or compared to other users who did the same case of even the same levels. What did they do? How well is everybody who maybe is a third year doing across the board? And so each case will have an evaluation of this sort, and they just keep getting more robust as time goes on. So that was what I wanted to show you with this video.